Hey guys, Dr. Kyle Loveless here again. I want to talk to you today about hormones. This is really big deal. This is something that but a good portion of patients that come in have hormone issues. And the reason is because we live in a high stress world. And unfortunately, when we live in a high stress world over time, the same thing that produces a lot of our hormones in terms of estrogens and testosterone and things like that is also the same thing that produces cortisol, which is what allows our body to help handle stress. That's your adrenals. And so the beginning portion of that comes from your adrenals. And so if your adrenals aren't in check, if you're living in a high stress world over time, those hormone levels are going to drop. Some of the things that we do different here at Queen City Health Center than your average doctor that you go to, even many of the natural doctors that you go to, is we want to figure out not only what your hormones are doing by testing and doing the blood work to find out your hormones and doing things like a Dutch hormone test to find out what metabolites are doing and what pathways your body's using to get rid of estrogens and things like that, but also figuring out what is it in your life that's led to this stress. I'll give you an example. I've had patients come in, younger women that come in that play sports, and they've gotten on birth control or they just don't have a cycle at all, and they go to a doctor and they're having all these symptoms, like these hormonal symptoms, they go cycle issues or cramping or whatever that symptom might be, low energy, and they go to a doctor and they give them some sort of hormone replacement like a birth control, or they do something like a functional medicine approach where they just give them some herbs that are just going to change their cycle around. But they never address the fact that high stress of exercising all the time is actually draining the adrenals to where the energy's not there to produce the estrogens that need to be there to produce a normal cycle for a woman. And so they're not addressing that root cause, and so that process is just there, and they have to be on that birth control forever for the most part for their cycle to be normal. And that's just not okay, because at that point, not only are you taking a medication to try to keep your cycle normal, you're also at a point where you're altering the endocrine system, which can affect being able to get pregnant down the road. It can lead to cervical cancers, breast cancers. It's just not a good approach long term. And so our approach is different. We're going to do the testing, of course. We want to find out what's happening, but at the same time make lifestyle changes. Start to change the diet, start to change looking at the gut. I've had patients where just their gut problems were actually causing their hormone problems, and we had to do more in-depth testing. So I guess what I'm getting at here is that hormones are obviously very important, but it's different for everybody on what the hormone problem is coming from. It's about investigating and figuring out where is the stressor in your life. How do we help support the body and those adrenals to get back into normal? And then how do we remove the unnecessary stresses in your life so that you can get your body healing again? If you're someone dealing with hormone issues, that's exactly what we do. We help you figure out what's causing it. So if that's you, schedule an appointment time. We'll sit down, we'll talk. You'll either meet with myself or Dr. Holly, my wife, and we'll sit down and figure out what is it that's causing it, and then give you a real game plan, a natural game plan to get you back on track, and then teach you how to make sure you stay that way for the rest of your life.